Welcome to This Explainer. I am so thrilled you're here with us, right? Let's jump right in. Imagine this. You're a highly skilled expat physician or nurse, and you're stepping onto the floor of a bustling Saudi hospital for your very first shift. You know the medicine inside and out. You've even put in the hours studying formal Arabic. But when you walk into that first patient's room, you quickly realize something. Those textbook phrases you memorized? Yeah, they don't quite match the rapid-fire, deeply cultural, everyday slang that's actually swirling around you. So, let's dive into this, because today we are equipping you with the practical, colloquial Arabic phrases you actually need to thrive, to build trust, and to deliver absolutely exceptional care on the hospital floor.
It seems like a perfectly simple question, right? But honestly, how you ask it changes everything. Do you use the stiff, formal phrasing you picked up in a language class? Or do you lean in and ask, "when alarm," which is how the locals actually speak? In a high-stakes hospital environment, you don't just need to communicate data, you need to connect. When a patient is vulnerable and they're in pain, speaking their specific dialect is hands down the fastest way to build that paramount trust.
To get you ready, here's our map of the hospital for today's shift. We're going to cover 1. Local slang and greetings, 2. The emergency department, 3. Bedside physical exams, 4. Nephrology and dialysis, and finally, 5. The ICU and empathy.
Section 1. Local slang and greetings. Now what's really interesting about this is the stark contrast between formal Arabic and everyday Saudi slang. Let's just take the word for water. The formal, standard Arabic word is mat. But patients in a Saudi hospital, they almost never use that. They say moya. If you walk in and start asking about mat, well, you're going to sound a bit like a formal news broadcaster, not a comforting bedside healer. Textbook knowledge alone just isn't going to cut it. You absolutely need that local flavor.
So let's look at some basic greetings that establish an immediate warm connection. Saying Hayyak Allah for welcome and asking Wish Ismak for what is your name. Now notice the use of wish there instead of the formal mada for what. This creates a really natural rhythmic call and response. It allows you to warmly yet highly efficiently gather all that crucial demographic info you need during a busy shift without sounding like a robot reading a script.
Section 2. The emergency department.
Okay, now we're rushing into the ER, where time is literally of the essence. You're trying to rapidly triage acutely ill patients who might be experiencing a life-threatening event. These rapid-fire phrases are your best tools here. Wish jabak? What brought you? Ala alam shadid? Are you in severe pain? And crucially, Ughmay alaik, did you lose consciousness? You need to be able to fire these off and understand the localized responses instantly to make those critical split-second clinical decisions.
And when a suspected neurological event comes rolling through those ER doors, your commands have to be flawless. So the crucial point is knowing exactly how to command motor responses during a critical stroke assessment. Step 1. Ibtasim, smile. Step 2. Irfa yadaynik, raise both arms. Step 3. Takdar tatakalam bi wudu. Can you speak clearly? There is zero room for translation errors here, guys. Knowing these exact words quite literally saves lives.
Section 3. Bedside physical examinations.
Now we're moving up to the inpatient wards for routine bedside exams. When evaluating a patient's physical state, you want to guide them clearly without overwhelming them with dense medical jargon. Tanafasatobi tells them to breathe normally while you listen to their lungs. Iftah famek to check their airway. And I absolutely love this last one. Kul li'idhe ya'wer. Tell me if it hurts. It's polite, it's direct, and it uses ya'wer, which is just the perfect colloquial term for it hurts.
And speaking of pain, you have to know exactly how patients are going to describe it back to you. If a patient says they have hargan, they mean a burning pain, which is absolutely crucial for diagnosing things like urinary issues or reflux. If they say magas, they mean cramping. By knowing these specific local terms, you're helping the patient pinpoint exactly what they're feeling, and you can classify their distress with incredible accuracy.
Section 4. Nephrology and dialysis care.
So let's step into the nephrology ward. And if you work here, I guarantee you're going to hear this exact quote all the time. Sharibt moya kathir. I drank a lot of water. It's the universal reality of renal patients. Despite all the strict fluid restrictions we put them on, human nature wins out, and they'll sheepishly admit to drinking way too much right before a dialysis session. Knowing the colloquial way they confess this, that's just part of the job.
Let's move to and see how this builds into managing the actual treatment. These phrases are how you manage both the clinical prescription and the complex machinery of dialysis. Bins Hamoyozyata means we'll remove that extra fluid. Al-potassium Murtafi tells them their potassium is dangerously high, and Al-fistula Shagala offers that much-needed reassurance that their vascular access, the fistula, is working perfectly.
But look, dialysis is really tough on the body. You have to understand their complaints in their own dialect. If a patient says taban maura, they don't just mean they're a little tired. Mara is a super common, powerful Saudi slang word meaning very or extremely. They are exhausted. Understanding that they missed a session, fatatni jalsa, or that their legs are swollen, is honestly just as important as issuing your medical orders. It shows you're actively listening to them.
Section 5. The ICU and empathy.
Let's slow things down a bit as our shift moves into the ICU. Critical care, whether it's nephrology, cardiology, or trauma, requires a highly specific toolkit. And it's not just about managing ventilators, right? It's about delivering difficult news. You have to walk this really delicate tightrope, balancing absolute clinical honesty with profound cultural empathy and hope. Because in the ICU, you can't just deliver data, you have to deliver care.
When you sit down with a terrified family, these are the phrases that ground the conversation. Al-maradi khatir, the illness is serious. But then you immediately follow it up with reassurance. Sawena kuli ili niktar alehi tibian. We're doing everything medically possible. Telling them the next 24 hours are important frames the timeline really clearly. It communicates the grave prognosis, but it does so without unnecessarily stripping away the family's hope. And you know, when you care for a family with that level of cultural respect, you might hear this incredibly beautiful phrase in return, Bayyadallah wajahak. Literally, it translates to, may Allah brighten your face, but it is a deep, profound way of saying thank you. Medicine is deeply cultural. Hearing an expression of immense gratitude like this signifies that you haven't just treated a disease, you have earned their profound trust. And this brilliantly illustrates how integrating deeply ingrained religious and cultural empathy is absolutely critical to providing holistic care. Wrapping up a visit with Allah yashfik, may Allah heal you, or simply saying, Insha'Allah, God willing, when discussing recovery, well, it integrates their worldview right into the healing process. It tells the patient that you honor exactly who they are, not just what their lab results say.
So as our shift comes to a close today, I want to leave you with this final thought. Think about your own practice for a second. How might speaking a patient's exact dialect, the colloquial words they actually use at home with their families, rather than some stiff, formal language, completely alter the trajectory of their healing process? Because when a patient feels truly understood, their stress drops, compliance rises, and the unseen healing power of culturally attuned communication takes over. Thank you so much for joining me on this explainer, and I'll see you next time.